No. We've been ready because remember, we work very closely with our schools, all of them.
Okay, maybe let's get some clarity. What is it that you were ready for? Were you ready for the escalating number of 3,000 students contracting COVID-19?
Well, the figure that you are mentioning, it's the overall figure of everyone in our schooling community. We just have over 1,000 of our learners. But we were ready for all the COVID-19 cases because our schools have standard operating procedures. They know how to manage cases. We work very closely with the Department of Health. I mean, you know that we have over 2,000 schools, and one way or the other, they will be affected. But it's not always the case where you have probably more than 2 cases or 3 in a school. So all schools that we have closed, we had more cases, and with the recommendation of Department of Health, then we had to close those schools, but interchangeably so, because you close schools for between 1 to 3 days, and they open. So one or the other, you will have schools that are operational after they have open after closure. So that's how we are managing the process now.
And how many schools has the Department of Health recommended that you close in Gauteng?
Well, like I said, I mean, interchangeably 20 schools, they've been closed since February, because it's difficult for you to have a figure that will say currently this is the number of schools that we have, because schools, like as I say, interchangeably, because they will close for 1 day, some will close for 2, some will close for 3 days. So it becomes difficult for you to say you have so many schools that are closed, because the others are closing while others are opening. But interchangeably, we can confirm that about 20 schools up to so far have closed, and some of them, they then open.
Is the department still going along with the proposition for schools to be open full-time, and for those learners who were going to school interchangeably to now be going to school full-time?
Yes, we are forging ahead on that one, because research has told us that we have lost so much curriculum time, and your primary school learners, they need supervision. They need someone in front of them to remind them on what they need to remember, and the rotation does not work for them. Even those schools that, your fee-paying schools that are doing online, at that level, they can't, proceed with on, because children need attention, and that's why we are saying we need to bring them back so that there's close supervision, and we will then continue to, to catch up on the curriculum time lost. I mean, the foundation phase is dearly affected, and once we miss the foundation phase, the learner will not be the same in the near future. So those are the things that we are mindful of, because the foundation phase is quite critical. Now, if you have a short circuit process where you see that there are elements that you probably might have passed or not focused on during the primary school level, then it becomes a problem when the learner go in the upper echelon of the schooling environment. I'm talking about your secondary and your higher education.
We've spoken a lot about the learners. What is the fate of the teachers at the moment? How many of them have contracted COVID-19 thus far in Gauteng?
Well, it's not 1,000, but around 800 that have, confirmed positive. But like as I'm saying, the number is incremental, meaning that since we opened our schools, you will have those that would have tested positive, but then probably isolate, and they then come back to our schools, because you know that probably after 10 days or so, status will then change. So they will come back. So what we are doing, we are monitoring very closely all the cases that we receive from our schools and advise on how we manage. But what we want to call upon to everyone that is in our schooling community is to adhere to COVID-19 protocols, make sure that we wear our masks, we sanitize, and this social distancing, because we have cases that we have detected in some of our schools where masks are not being worn, and there is a reluctancy of social distancing. So those are the things that we have seen, because these cases are coming after we have closed the sporting, activities, because that we had many cases coming from sporting activities, and we said no, let's probably reduce the participation of learners in sporting, but we still then have these cases. So there's a reluctancy of wearing of masks and the social distancing, and we want to call upon our fellow counterparts in our schools to make sure that they adhere to all those protocols so that we then manage the pandemic.
There's been a delay, Mr. Mabona, in the inoculation of teachers. We know the situation that we're currently under with Johnson & Johnson and the contaminated batches. What plans had you made, and what were you getting ready to activate in lieu of the vaccination of teachers? How much does the spanner in the work actually affect the plans that you'd made for teachers?
No, that will not fall on our purview. It's the Department of Health that will be responsible for that. So it will be unfair for us to enter into that space, because any plans that has anything to do with vaccination, it will be a responsibility of Department of Health.
I ask you this, Mr. Mabona, because the vaccination process and what happens there does in some way, actually in very big ways, affect the plans that you, as the Education Department, would make in Gauteng. As in knowing that teachers will be inoculated, that might affect the plans that you then make as to how you run the curriculum, as to what you allow at schools and what you don't allow, knowing that perhaps a certain number of your teachers would have been deemed, quote-unquote, safe or inoculated and vaccinated.
No, but our plans will be informed by what Department of Health will be saying, because our plans will not be isolated because we don't run vaccination process. So from where we are sitting, we take a call from the Department of Health on what is it that they are planning, and our plans will then be synchronized to what they would have had. So it will be really unfair for us to, as a department, to plan on the probably the plan that is supposed to be managed by Department of Health. Once they put a plan on the table to say, this is how we want to manage this process, then as the Department of Education will be in a position to say, yes, in our processes, then let's accommodate this process in this fashion, because this is the plan that we have from Department of Health. But we cannot have our plan, what is it that it will be informed by? So it will be really unfair for us to plan if we don't have, a guidance from Department of Health.
The Department of Health. Well, thank you very much, Mr. Mabona, for that update this evening regarding education and schooling in Gauteng. It seems like it's still all systems go, despite the rising number of learners contracting COVID-19.